Alberta Primetime with Michael Higgins.
Welcome to Alberta Primetime. Ahead tonight, our Friday panel on the reemergence of separatism sentiment. But first, Alberta moves to fill a health gap.
Redirecting patients to urgent care centres would free up much needed capacity in our hospitals while providing improved patient experiences.
The government putting $17 million toward the planning and development of 8 urgent care facilities, including $2 million for an integrated and primary care facility in Airdrie to be run by a private contractor. It's expected the move should redirect up to 200,000 emergency room visits annually. Joining us now to pick up the conversation, Lorian Hardcastle, an associate professor in the Faculty of Law and Cummings School of Medicine at the University of Calgary. Dr. Hardcastle, good to see you. Welcome back.
Thank you for having me.
All right. With Alberta's population continuing to grow, how do you view this as a move to build capacity within the system?
I think it is an important need that we have in the system. Of course, the long wait times in ERs are well known, and being able to send patients somewhere other than the emergency room helps things certainly in the ER. And I think we're also seeing more and more patients who don't have family doctors or other primary care who end up needing somewhere to find care if their conditions get bad enough, they become sick enough. So certainly this fills the gap there.
Okay, so filling a gap. Is it though a stopgap measure? How do you see the proliferation of urgent care centers factoring into Alberta's health delivery model moving forward?
In some ways, it can be a stopgap if we're running into situations where patients don't have primary care, don't have a family doctor, and are waiting and getting sicker, and their situation is getting bad enough that they require urgent care. That, of course, is not ideal at all, and we don't want people to be turning to urgent care centers because they don't have primary care. But if you have someone who, for example, does have primary care but has an urgent healthcare need arise on a weekend or on the evening when their family doctor isn't open, this can be a good place for them to get services that isn't going to the ER.
The government says the centers will be run by AHS and publicly funded. Now, with the overhaul of healthcare, AHS also being transitioned from sole health authority in the province to a contracted service provider. How do you see that changing dynamics around contracts to run urgent care centers?
So it isn't clear if AHS will continue to run all of these urgent care centers or if we may see other entities delivering urgent care, just as we're starting to see for-profit entities operating surgery facilities. That said, I think probably the economics of privately delivering surgical services is more appealing to those for-profit providers than is operating urgent care. There's a lot of uncertainty in urgent care and these sorts of things that make it perhaps less financially appealing to deliver those kinds of services privately. So I do think probably we would continue to see AHS operating these facilities.
How precedent setting is it then that there is a private contractor driving development around the urgent care facility in Airdrie?
Yeah, I think it's unexpected perhaps and something that we haven't seen. There are already, though, private delivery walk-in clinics. So walk-in clinics that are operated by groups of family doctors or even chains in some cities. Those are currently private delivery, and so there is some precedent for it at the walk-in level, maybe less so in the urgent care space.
We talked about filling gap before. How far will this go to filling a healthcare gap in a city the size of Airdrie, where there is already an urgent care facility, but there isn't a hospital? Could this free up the province from having to build a hospital in a city the size of, and growing, 80,000 plus?
Yeah. Well, I think there's always these cost-benefit analyses in terms of when is the population big enough and its healthcare needs acute enough to need a hospital. When can we get by with just urgent care? And so those are conversations. The other conversations that we can sometimes see are if there is going to be urgent care centers, are they going to be 24 hours? What are their hours going to be? And there have been tragic situations in the not so distant past where patients thought that urgent care facilities in some of the communities around Calgary were open 24 hours and went to get care there and found out they weren't. So there's issues around how many urgent care centers they are, what hours they have. And the other issue, though, is of course the staffing issue. You can open facilities, you can build hospital beds, but do you have the staff to operate them? And so if we're going to open these facilities, where are the doctors coming from? Are we pulling them from the community where they're treating patients as family doctors? Are we pulling them out of the hospitals? So we also have to think about where those physicians are using their time and what we might be taking them away from if we open these facilities.
Staffing, yes, absolutely. A hugely important point of discussion in healthcare moving forward. And maybe one more quick question for you. Are there signals to be read here where hospital infrastructure is concerned? There was reference in the recent provincial budget to an April 1st shift in ownership. Hundreds of health facilities resulted in columnist headlines asking if public hospitals are to be sold off.
Well, I think that we're going to see a period of transition over the next few years with AHS becoming more of just an operator of acute care in hospitals and not in other parts of the healthcare system. But then will we also see other people get into the hospital space? Will we see more Covenant facilities? Will we see other facilities? And so we don't know what hospitals are going to look like in a few years, but it is clear that they're having serious capacity issues. And so the more that we can do downstream with urgent care, with making sure everyone has a family doctor, potentially easing some of that burden is useful.
All right, we'll have to leave it there. Appreciate your time as always, Dr. Hardcastle. Thank you kindly.
Thank you for having me.
Lorian Hardcastle is an associate professor in the Faculty of Law and Cummings School of Medicine at the University of Calgary.